Hey guys, Dr. Jason, chiropractor here at Limitless Chiropractic. This week's Tuesday TikTok, we're going to be talking about pregnancy and birth. So, for those of you who missed it, I think it was about 2 months ago now, we did a pregnancy and birth class with midwife Grace, talking all about Webster technique and pregnancy and birth process and just some of the benefits. So we're going to do a little brief synopsis on that for those of you who missed it, okay? So, when we're talking about pregnancy and birth, really, there's in the textbook that all the OBs use, right? There's three main points that they talk about, and it's the 3 P's: power, passage, and passenger. Okay, so power just means the nerve that goes to the uterus. The uterus is the muscle. Okay, so chiropractors, right, adjust the vertebrae to free up the nerve that goes to the uterus. So that's how we kind of affect the first part. Okay, now the second part is the passage, right? So that's how baby comes through the birth canal. Okay, so we're gonna have a little diagram that shows you the movement of the pelvis and the sacrum and how it functions, okay? But basically, it opens up, okay, and closes, and opens up and closes, okay? So when we're going through that birth process, we can also have some rotation in the pelvis there, okay? So when we walk, that's what our pelvis does. So if we have a subluxation, okay, a fixation that doesn't allow the pelvis to open up in one of those forms, right, one of those movements, well, that's what's going to create a dystocia or an abnormal progression of labor, okay? So as a chiropractor, that's what we're doing, is realigning those vertebrae to take the pressure off the nerves. So through the passage aspect of the 3 P's in Williams Obstetrics textbook, that's how chiropractors address that, right? So then the passenger aspect, right, the baby, right? Well, as a chiropractor, what we're doing with Webster's technique, which is the pregnancy technique, right? So Webster's is all about balancing the sacrum, okay? So we address the bone, muscle, and ligament on the backside, and the bone, muscle, and ligament on the front side of the pelvis, all trying to help, right, make sure your pelvis and baby are in an optimal position for that birth process, okay? So, love any questions, please reach out to us. Love to hear from you. See you next week.